guys, my name is Kelly Thompson. I am chair of NANN's membership committee who's hosting tonight's NANN Connections on bullying. We had some technical difficulties with our initial NANN Connections that we had live recorded. So please bear with us during this NANN Connections. I want to first welcome everyone to our third NANN Connections. My name is Kelly Thompson. I'm a neonatal nurse practitioner at Community Hospital in Munster, Indiana. I am also chair for NANN's membership committee who is hosting tonight's event. I would like to thank my colleagues on the membership committee and NANN staff members, Molly and Madison, for doing the work behind the scenes to make these events possible. NANN Connection events were born from feedback we had received from NANN members and the 2020 annual conference attendees who shared they wanted and needed more opportunities to connect with their neonatal peers from around the world. NANN will continue to host similar events free to all neonatal nurses throughout 2021. If you have missed any and want to view them, please go to NANN's website and search NANN Connections. You will be able to view February and April's NANN Connections. Before we get started, we want to hear from you via our Zoom polling system. When prompted on the screen, please share with us your primary nursing role to help us get an idea of who is here with us tonight. We'll wait a few seconds and see what the polls show. So it looks like tonight we have a majority of bedside nurses with us. So welcome to tonight's NANN Connections. We are going to do another polling question with tonight's topic discussing bullying in the NICU. Please let us know, have you ever seen bullying at your workplace? Have you been bullied or none of the above? Again, we'll wait a few seconds to get the responses. So it looks like a majority of the people who are here tonight have either witnessed bullying in their unit or have been bullied themselves. So again, this is hitting close to home, guys. We are seeing this in our units in NICUs. It's not other units. Other units are seeing it too, but it is right in our unit in the NICU. So this is an important topic. I'm glad this is something that we can talk about and kind of go into more detail with you guys tonight and kind of have a good discussion on this. So this will be a great NANN Connections, and I hope you guys are able to learn a lot and take some information back to your units. Throughout our time together, please feel free to ask any questions anytime during this Zoom call. Just put it in the chat box and we'd be more than happy to answer what we can. And remember, just by joining us tonight, you've been entered into a gift card giveaway for a $100 spa gift card finder. So you can add some self-care into your everyday life. Stay tuned to the wrap up at today's session to find out if you won. You must be present on the call to win. I would like to take a moment and introduce our panel who will be taking part in our conversation circle about bullying in the NICU. Tonight we have with us Jocelyn, Corey, Erica, and Mary. Thank you guys so much for being a part of our conversation circle and being part of our panel tonight. We look forward to hearing what you guys can share with us from personal experiences and what we've gotten from the book that NANN provided us. So prior to tonight's discussion, the NANN membership committee prepared by reading the book, Fast Facts on Combating Nurse Bullying, Incivility, and Workplace Violence, What Nurses Need to Know in a Nutshell. Our conversation is inspired by this book, and we encourage attendees to read it and follow up to tonight's event. Here's what the book looks like. You can order it on Amazon. So we were all given a copy, and we based some questions off what we learned in here to kind of go over some stuff with you guys. Okay. Just a quick note, for the best experience, switch your Zoom view to speaker view via the 3 dots in the upper right-hand corner of your screen, and feel free to unmute yourself during the conversation to take part in any of the discussions. Use the raise your hand feature to be sure we don't miss any of your insights and contributions. Now let's get started. Okay, so in 2008, the Joint Commission said that bullying behaviors can foster medical errors, contribute to poor patient satisfaction, and preventable adverse outcomes. It can increase the cost of care and qualify clinicians to seek new positions. So the first question we're going to post as a poll are we seeing people leave that are qualified, Are we seeing increased medical errors in people who are bullied? So we'll give it some time and we'll post the question up. So it does look like we do have some people who have seen people leave because of bullying and medical errors. So this is something that we are seeing on our units. A lot of times people have medical errors because information is withheld from them. So when they are not given all the patient's information, there are medical errors that are caused in their units. And that's just the way that the bully can kind of cause some issues with these people, that they're bullying is, withholding this information. So, not only is it hurting the person that's being bullied, but it's also hurting our patients, which is not fair to the patients. So it is something sad that we're seeing. We are seeing people who are qualified leaving our units. There is anywhere from a 30 to 50% turnover within the first year of new grads coming into different units due to bullying and other issues, but a majority of it is bullying. So we need to support our young, our people who are coming in to help work with us in the NICU. So now we're going to move on to question number 2.
If I can confront somebody on my same level, like is this something that I need to go to management about? It seems to me like either way, regardless of it's vertical or horizontal, there's a lot of concerns about how you go about approaching the person.
Do you, as a group that we have here tonight, you can either put in the chat box or feel free to comment on here on the recording. Do you guys feel you see more in your workplace a vertical or horizontal bullying?
This is Tommy Farrell, and I feel that it depends often on the size of the unit that you're working on. I've seen both, and some of it is subtle, some of it is pretty maybe not so subtle. I mean, there are times when people have been hesitant to speak up because that person is the person who's in control of their schedule. And I think that a lot of that goes on not just in a NICU, but across nursing.
Thank you, Tommy.
Mm-hmm.
It looks like in the chat box, we have a majority of people putting horizontal. We also have people, putting that they see both. So I do feel, in a workplace, you will see kind of both. Like Tommy said, depending on where you work, you might see more one versus the other. But, likely in the NICU, we are going to see both. So thank you guys so much for commenting and helping us, talk about that question. We'll move on to the next question. It's more of a discussion. We're going to discuss how nurse bullying is defined and what their actions look like. So in the book, the American Nurse Association defines bullying as repeated, unwanted, harmful actions intended to humiliate, offend, and cause distress in the recipient. Bullying actions include those that harm, undermine, and degrade. And an unfortunate occurrence has been noted among those familiar with bullying in nursing. Nurses often reject offers of assistance in dealing with this crisis. So they have a bunch of stuff in this book listed about actions of nursing. So I will just highlight a few of them. Showing hostility, humiliating, acting out in anger and impatience. If in management, assisting patient care that is either above or below the scope of practice of the victim. Delivering verbal attacks, taunts, or insults. Giving the silent treatment. Spreading rumors and lies that no one refutes. Withholding support, withholding vital patient care information, micromanaging, sabotaging the victim's work, playing practical jokes that are excessive and hurtful, teasing and sarcasm, ignoring policies and procedures, ignoring presentations given by others, and excluding others from social events outside of the workplace. Now that's just a few of what they listed that I went through. would someone like to go further, maybe what they've seen in their workplace, actions of a nurse bully that they might have seen, or to expand on nurse bullying, the definition?
I think that the harder to describe behaviors are the ones like the silent treatment or refusing to give help. Those are the ones as a leader that I find are the hardest for other nurses to bring forward to me, because they didn't necessarily do anything wrong. They just weren't being nice. Do you know what I mean? And so sometimes those subtle behaviors, I think people are less willing to bring to the attention of other leaders, because they don't really recognize that this is still bullying or incivil behavior.
Thank you. So it looks like in the chat we have some people posting some things that they've seen of gossiping. It looks like Wendy had posted in the UK we have different grades, band 5 QIS and non-QIS, then sisters and senior sisters. So we have a lot of incivility and bullying both vertically and horizontally. I've seen a lot of bullying over the years during report, public shaming when you make a mistake. So thank you for everybody who's participating in the chat. And again, this is, you know, there's so many different things listed in this book. I just touched on a few that they went over. Does anybody else want to comment in on this?
Kelly, hi.
Hi, Jen.
I'm Jen, and I'm a neonatal intensive care nurse from New Hampshire. And I just want to echo what was her name?
Jocelyn?
Jocelyn was saying about silent treatment and the passive aggressive comment that Jamie Phillip have mentioned. When you were mentioning the manifestations of what bullying would look like, you know, it just confirmed how I felt when my nurse unit manager has started to do some silent treatment and some sort of withdrawal of support in the recent times. You know, I felt that it was just me misinterpreting how I am feeling by the way she's acting towards me. But it started out as when there's awards institutionally, you know, she would congratulate the rest of my peers who have received award, that I wouldn't be part of the recognition list. And I thought it was just a simple, oh, maybe she forgotten. And I didn't really mind because I wasn't really paying so much attention of being recognized, because that's what we do. We just do whatever we have to do. And we don't really care whether or not we get placed into a spot or a limelight or anything like that. But when it becomes a repetitive thing, you kind of wonder, why is this happening? And you know, when these things happen, you get demoralized. You get that feeling that, oh, maybe I wasn't good enough. So I guess I will be waiting for the recommendations, what and how we should be doing and responding to these behaviors in order to you know, keep up with the usual actions that we should be doing towards our professional promotion and our growth.
Thank you so much, Jen, for sharing your story and what you're going through. You know, it's not fun being in your situation. Thank you for sharing it. And we hopefully will get to that tonight. Kind of what, you know, hopefully there's some things that we can throw, you know, out there for people who are in your situation to kind of help them figure out which direction to go and where to go to next in these kind of situations. So thank you so much, Jen, for sharing that with us. We appreciate it. Oh, okay. So the next question we have, it's also going to be a poll question. So the average age of a bully nurse is actually age 50. The average number of years of experience in nursing is 20 years. Is anyone surprised by these facts? What about a novice nurse? So we're gonna put out another poll. So if you've been bullied, how long have you been in your position? Was it 0 to 1 years, 1 to 5, 5 to 10, or 10 plus years? Okay, so it does look like on here that if you've been bullied, you had been in your position for 10 or plus years, and everybody else was kind of around the same percent from 0 to 5 years. I honestly was kind of surprised because I feel like I had hosted a early career focus group at the Savannah conference, and one of the things that they had said was bullying, you know, as a novice nurse and stuff like that. So when I was reading this book and they talked about the average age is 50 with 20 years of experience, I was actually kind of surprised. So would anybody like to tell us anything, you know, novice nurses, have you been bullied? You know, senior nurses, you know, bullied, you know, what, if you want to put in the chat box, you know, information, we'd love to kind of expand on this and talk about this.
Well, my name's Tanya Ticon, and I'm from Manitoba, Canada. I've seen bullying in all ages, right? And I can tell you, I'm 54, so I guess I'm your old bully nurse there. But I've seen bully, like I've been bullied in my early career, my middle career, and I'm now an educator. I was never bullied as an educator. Then I got new managers, and wow, that was a whole new experience, and lots of bullying happening there. I find now with COVID, I'm sure that everybody else must feel that everybody's just on the edge. And I think overall in the whole unit, bullying has increased significantly just because I find people are so stressed and snappy and stretched. And I don't know what is happening with you guys, but we're being forced to support the adult world. So we go over as helper nurses and help work with adults, even though I haven't touched an adult for 29 years. Things like that. So we're a very stressed workforce here in Manitoba. I assume everybody else is experiencing similar stuff.
Thank you, Tanya.
Hi, my name is Haley Yombor. I work in Nebraska and as a bedside nurse and also as a recent A&M, but I've worked at multiple different hospitals, and I guess kind of what I've found is the bullying with age, sometimes it looks different. With tenured nurses, sometimes it's more of a competitive, well, I've taken care of them for so long, so on my shift, I was able to wean them more by this with their O2, or I was able to feed them more by bottle. And with younger nurses, more of a threatening type behaviors or ignoring and things like that. So I think it's just interesting how people feel they need to compensate for their superiority in those situations.
Thank you, Haley. Yes. It is, you know, important, and thank you so much for sharing with us your story. To look in the chat, it looks like we've had a few people talk about seniority on your shift. It can be early in your career, but the senior on your shift, that is who's bullying on our unit, 3 to 5 years of seniority. Cliques and groups people are seeing, spreading rumors, transport nurses group, knitter groups. It is sad to see that we're eating our young. I know, Karen, you have your hand raised if you want to unmute yourself and share your story.
Okay, thank you. I just was going to say, I'm over 50 and I've seen bullying throughout my career. The main bullying personally was when I was a new nurse, but I've experienced it over age 50. We started in our NICU a really successful mentoring group, and I've been a mentor to new nurses for the last 5 years. And that has significantly cut down on bullying. And the other thing I wanted to say was we also had to float to the COVID unit from the NICU. Many of us, you know, having spent years, 25 plus years in the NICU, and we were badly bullied by the adult ICU staff. It did not matter our age. I didn't have that happen, but a lot of my coworkers did, and it was shocking.
That's it. It's like here you're going to help them, you know, to be an extra set of hands, you know, and to be, you know, in that situation is, you know, they should be happy that we're there helping them and stuff. So sad to see that happening, even, you know, when we're being an extra set of hands for people, you know, to see that happening. So thank you, Karen, so much for sharing that with us.
Thanks.
Okay, we're going to move on. We have a lot of questions to get through, so we're going to try to get through as majority as we can. So the next one's about incivility. It's defined by the American Nursing Association as the action that takes the form of rude or discourteous actions or gossiping and spreading rumors and refusing to assist coworkers. If left unchecked, can progress to bullying. How do you address these behaviors so they don't progress? Can I have someone on my panel kind of talk about incivility?
Hey, this is Erica. So the big difference between incivility and bullying is that bullying is purposeful and deliberate, and it is intended to harm the receiver either physically or psychologically, whereas incivility are just kind of those behaviors that are happening kind of maybe without being thought through or not purposefully, but they need to be stopped in the moment because those actions over time could start turning into more purposeful and more deliberate actions. And then that's when it is hard to kind of reverse. So if it's a new behavior, no matter if it's new or not, you should always try to stop it. But if you are able to experience this behavior, it's best to stop it, as soon as possible, to in the moment, or to find your mentor or to find your manager and figure out how to deal with it before it does become more aggressive.
Thank you. So in the chat box, it looks like Shannon had put that she's finding bullying behaviors occur around proposed changes. There seems to be a grouping phenomenon, and the group teams up against those proposing or leading the change, us versus them, along other issues. Then let's see, we had Ginny had put, when onboarding a new colleague, if they don't fit in the typical mold of a NICU teammate, they tend to be ostracized. And it's hard when they are not accepted through, they may be more introverted and or older, more mature when they enter the nursing profession and new grad. Life stages tend to be strongly influenced team culture. So yeah, I feel like incivility is what we see first, a lot of times, which will then lead to the bullying, which we kind of need to stop, start stopping it at the incivility before it gets even worse. So hopefully we'll be able to kind of talk about the next steps, what you can do if you're being bullied. That's kind of where our next question is going to lead us, is when being bullied, what should you do? In the book, they actually have a website that they share. It's called www.kickbully.com. And it sounds like it's got some techniques and other resources for people who are being bullied. So again, that's www.kickbully.com. And in the book, they do list some information on what you can do. They have a bunch of them, but I will kind of just go through some of the highlighted points. They have 3 pages worth of different things. So do not ignore or excuse the behavior. You need to set limits on what you will tolerate from the bully. Be aware of the unit or facility policies and procedures in dealing with hostile behavior. Try not to be afraid. Fear will cause you to not take action against the behavior. Begin by attempting to come to a resolution between you and the bully. Do not state how the behavior has made you feel, how his or her behavior is impacting the care of your patients or work overall. Make sure you document it. Include the date, the time, the location, and those involved. Give specific details of what occurred, including how you attempted to stop the behavior. The fact that the patient care is being impacted will be important to the management if you need to go and go up the chain of command to talk about what's going on. If it's a charge nurse, nurse manager, or director, or nursing is the bully, report the incident to human resources and ask for assistance. You can ask for help in dealing with a bully, refer to facility policies regarding what help is available for your employees. Be aware of what actions warrant notification of the police. Speak, again, talk to human resources. They talk about documenting some more. Be aware of your own behaviors, how you're acting. Don't share your documentation with anyone. Take care of you. Don't take matters into your own hands and retaliate against the perpetrator. And see professional counseling if needed. Like I said, I just touched on a few of the ones that they listed. There's 3 pages in this book that kind of goes through different things that you can do. So has anybody like to share what they've gone through? The other thing that they talk about in this book is if you are being bullied and you want to report it and stuff like that, or to go against the bully and try to get stuff fixed, is a lot of times people lose their job over it. So they stress that in this book to make sure if you are worried about losing a job that you have something lined up before going and fighting it. So that is another thing they really stressed in this book, which is pretty sad if you're the one getting bullied that you are the one possibly that's going to lose your job. So does anybody have anything they would like to share about ever, confronting a bully or what you had to do they would like to share with us? You can either put it in the chat box, raise your hand, or feel free to unmute yourself and start a discussion.
Sonia, you have your hand raised. Do you want to go?
Hi, everyone. I'm a nurse manager in Los Angeles, and we unfortunately see this from time to time. And what I have experienced in trying to intervene with situations of incivility or bullying is if the staff member who is experiencing that doesn't speak up right away. If they tell me a month later, oh, this person said this to me in the break room, or they refused to help me when my patient was, coding or whatever, it's hard to do anything with that, later on down the road. So I encourage everyone to promote timely feedback and reporting it to their supervisor or manager quickly, because it depends on your HR department too, like how things are handled. So timely feedback, or at least reporting it to the charge nurse or supervisor manager person is incredibly helpful.
Thank you, Sonia, for talking about this. It looks like in the chat, Jen had put document where. So they didn't say like you had to have a journal or something, but just on a piece of paper, like if you're, at work, grab a scratch sheet of paper and put down what time it was, what was going on, who was doing it. You don't have to be sitting there in front of the bully doing it, but just so if you do have to go to HR or management or something, you have the exact details on it. So you're not trying to remember when you're, going to HR or the management exactly what happened. You have it all documented. Let's see.
Another comment about the journaling, that can be good for a couple reasons, because for one thing, it might help you process what's going on, or at least validate that what's going on is in fact bullying or unacceptable behavior. Because I think, especially as women and nurses and caregivers that we are, we do try and keep moving on and push things to the side. So journaling can be very good for us to work through what's going on for us personally, but then also for that documentation, not necessarily like you're going to take this to a court of law, but to see that this is an ongoing pattern, that things keep happening. It may be a way of sharing with a spouse or another somebody else that you're close to, what's going on, and they could be an objective person to look at those items and say, oh yeah, definitely wrong? How are you even working in this environment, or give you that feedback, that encouragement that you need to report it or deal with it head on that you might not otherwise have that courage to do.
Thank you, Mary. Also in the chat, it looks like Coral had put another unfortunate thing is when people have issues with bullying and they go to a supervisor, they are told to toughen up and deal with it. So that supervisor is kind of then supporting what's going on instead of kind of listening to the person who's being bullied, or, you know, maybe that person, you know, saw a person being bullied. So at that point, depending, since you did tell your supervisor, at that point, you know, that's kind of when you would start going to HR level up, because obviously that person is, you know, supporting the bullying that's going on. So you need to go further, especially if you're the one being bullied or seeing it, because you want to, you know, get that stopped in the unit. So yeah, Jen also put finding the courage to speak up in the process, advocating for oneself is vital, but it's reality going through it is hard. Kind of going with that, what Jen kind of put, we will talk about, it's called Healing the Walking Nurse. So what that is, it's a nurse who has been bullied, and it kind of goes through what they have to go through to kind of get through the whole bullying. There's 3 different stages that they have to go through in order to help other people who are being bullied. So they have to ask themselves, what happened to cause the pain and trauma? Was there anything that could have been changed? How should it have been handled differently? What can they learn from this incident? Has this incident affected me or other people that whom I care about? Can this incident be used by me to make my life better? Once they recognize that the incident is transforming it, nurses must be transcended, must then transcend the incident. This means that they use what they have learned from moving through the steps in order to assist others around them, including patients and colleagues dealing with their pain and trauma. The nurse is able to say, if not aloud, then to the self in his or her actions of care, I understand your pain and how can I make things better for you? The nurse must successfully move through all 3 steps in order to become a wounded healer and have the ability to empathize with other person. So a person who's been bullied has to get through those 3 steps in order to help someone else. So they do talk about it's called Healing the Walking Nurse. So I just wanted to kind of throw that in there since we were talking about how hard it is to go through if you're in that situation, and what you have to do to, you know, accept it to help other people who are going through that situation. So next we can kind of discuss some common signs of a nurse being bullied. Some of the signs that they listed in the book include appearing exhausted, they're taking mental health days, verbalizing of depression, frequent absentees, frequent complaints about illness or physical distress, verbalizing of thoughts of suicide, verbalizations of feeling burnout, complaints of headaches, eating disorders, and depressions, to list a few. Has anybody would like to share maybe someone that they know had been bullied and kind of what they saw that person was going through, or any of those things I just listed that they have seen? You can either, you know, jump on and, you know, talk or put it in the chat box.
I know as a leader, I have encountered a nurse who was the victim of bullying, and it did get addressed, but she definitely had a hard time getting past it and had to take some time off to heal. And so some people have super thick skin, but some people don't. And I think that we all are allowed to feel the way we feel, or, you know, have our own perception of interaction. And so it can have a pretty severe impact on nurses. I've definitely seen that.
Thank you, Jocelyn.
Mm-hmm.
So Ginny put in the chat box that as leaders, peers, and colleagues, most bullies or those who are being uncivil have unmet needs in the workplace. I sometimes see those who are struggling personally or professionally. They will sometimes display violations and standards of behavior and professionalism. Peer-to-peer accountability and relationship-based care is crucial to improving the culture.
Mm-hmm.
I agree with that 100%. Thank you, Jenny, for putting that up there. Okay, so next we are going to talk about, if you plan to confront the bully, what should you do and what should you know before proceeding? Again, I had discussed this, doing this may cost your job, and do you have a backup page? So in the book, they have listed some great things of what, you know, to prepare. So again, they put, do not begin the battle until you have another position which you can go to if need be, because like I said, a lot of the times it's sad to see, but in the book they do talk about a lot of, you know, it's the person who's being bullied seems to lose their job. To vent to a friend who is not a colleague. So preferably if you're being bullied, don't be talking to maybe coworkers or something, because, you know, then you're starting, you know, might not be spreading rumors, but it could be spread and turn into what wasn't said. So you're better off sharing it with a friend who you do not work with or a family member. Change your outlook. So identify what's really going on within the unit and the healthcare facility as a whole. Has the facility recently adopted a zero tolerance policy, and are the policies and this outlook towards bullying? Be fully aware of what will happen if you lose the battle against the bully: job loss, loss of friends, feelings of incompetence, sadness, anger, and frustration. Will you be happy staying on your unit with that at that facility? Would it be better to find another job or continue your education? So if you stay, will the bully become more even nastier and more of a fight for him and her? The manipulation will continue and become worse. Will your fellow staff be intimidated and not supporting you because they don't want to be bullied themselves? Again, that's just a list of the few topics that they discuss. Would someone like to talk about this more, or even, you know, maybe they've seen it in their unit and what happened?
Jenny, do you want to go?
Sure. So I think one thing that's really helpful is really fostering those mentoring relationships. I think everybody receives that feedback when they're in undergrad or going through nursing school: find a mentor. And I think sometimes there's this intuition that a mentor has to be like way older or way wiser, or maybe in their position a long time, but really it has to be a colleague that you feel safe and vulnerable with, to have that safe space to productively vent if you need to, or productively seek out help if you need to. And I think even if those peers and those mentors are somewhat closer in age or experience, that's still very valuable to find that vulnerable person that you can rely on in a very safe way, especially if you have to try to confront a bully or somebody who's picking on you. Again, you can take that relationship-based approach when it comes to, and like Sonia said, actually having concrete examples to share with that peer. But I think mentorship is such a sometimes lost art in nursing, that nursing is an apprenticeship. So learning how to deal with bullies can very much be learned even by somebody who's not much more experienced than you.
Yep, I agree. And in the chat, Caitlin had actually posted, in our unit, instability seems to be passed down. Newer nurses that are bullied seem to pass it down to the next group of newer nurses. So definitely, and I agree with, you know, it always doesn't have to be the brand new nurse with, you know, the most senior nurse. It is about finding that right preceptor that messages well, and that's what's going to make, you know, the best, you know, working environment during that time that they're learning to be a NICU nurse. So thank you, Jenny, so much for, you know, commenting on that. Okay, so next, we're going to talk about, list some ways you can handle a highly aggressive bully. So some other things, they had talked about a highly aggressive bully, and they listed some things about how to handle them. They talked about you can ignore the behavior, dismiss the bullying, seek to understand the bully, give a friendly speech to the bully, sometimes just say no, put the bully off, confront the bully privately. Always state the facts when you are confronting, never how his or her behavior makes you feel. The bully does not care how you feel, which is why he or she is the bully. Use phrases like, I was told you said blank about me. Is this true? Can you suggest some things we can do to solve this problem? You can, after you receive this response, ask for follow-up questions to be sure you have all the information you need and possibly figure out why he or she is bullying you. If the bully is a reasonable suggestion, if bully has a reasonable suggestion, then agree and end the meeting. However, what usually occurs is that the bully is unable to give any useful suggestions, in which case you should proceed to give a friendly speech, step up previously mentioned, and then end the confrontation and leave the meeting if it is, you know, getting worse. You also want to allow the bully to speak, let them kind of tell, you know, their side, what's going on. You can question what the bully is thinking. You can apologize. This apology is not heartfelt or meant on your part, but after saying it, walk away. For example, I'm sorry that I bother you so much. You can force the bully to explain his or her behavior. Why are you blaming me? Use compassion, state that the bully is being a really good person who is exhibiting bad behavior. So those are, like I said, again, pages of different things that you can do in here, but that's just a few that I listed. Does anybody have any other ways that they've dealt with a bully that they can share with us here tonight, personally, that you've dealt with, that you're comfortable sharing? This is a hard topic. Some people, you know, don't want to share it, and that's a-okay with us. And like I said, this book we put in the chat box how to order it. So if you feel like ordering it, and like I said, there's all sorts of different information in there. We actually have a bunch more questions to get through. However, our time is up. So we are going to end the meeting. I'm actually going to talk with a few of the NANN staff, and maybe in the future we will continue to have another NANN Connections to get through everything that we wanted to get through tonight. So thank you so much, everyone, for participating in tonight's discussion. It was such an important topic for us all to better understand. And I hope everyone can be more aware of incivility and bullying in the NICU, and hopefully bring some of this information back to the NICU and staff to help with this problem that we are facing. Also, NANN has the NANN's NICU Knowledge Share videos on bullying in the NICU available on the NANN website and the YouTube page that they have. Erica was the one that recorded that. So thank you, Erica, for participating in tonight's event and also providing that video for NANN and recording it. And also there's a NANNcast episode on incivility and bullying in the NICU that is also available on the NANN website, or you can go to your podcast app and look it up. Before we go, we want to let you know that we'll be following up with a quick survey via email to get your insights on tonight's events, as well to find out future topics that you would like us to talk about at future events. Please take a moment to answer this survey that will be sent out to you in an email so we can plan the most meaningful events to you guys. And we will probably ask if you want to continue, because like I said, we had a bunch of stuff we didn't even get covered tonight. I'm excited to share the date and time for the next NANN Connection, scheduled for Thursday, August 12th, same time from 6 to 7 p.m. Central Standard Time. During this session, we're going to be discussing dealing with the loss and hopefully having a guided meditation session. Look for more details to come in various NANN communications, and remember, these events are free to all members, not just NANN members. So please include your entire neonatal nursing community and let them know about these NANN events. We encourage peers to attend and connect with us in the future. So thanks so much for joining us. It's time to announce the winner of our spa gift card. If I announce your name, if you can either unmute yourself and turn on your camera, we'd like to snap a picture of you. I have a few people listed, so we will go with the first person. Tiffany Marchand, are you here tonight with us? Tiffany Marchand?
There she is.
Tiffany, can you put on your camera?
Hey. She's on mute.
Can you unmute yourself, Tiffany? Is she there? Tiffany? Yeah?
She's there. She's just on mute.
Okay. Well, Tiffany, congratulations. You have won a $100 Spa Finder gift card from tonight's event. A person from the NANN committee staff will be getting that out to you in an email. So thank you so much. for taking part in tonight's event. Again, thank you everyone for joining us tonight and taking time out of your busy schedule. We hope to see you guys again at our next NANN Connections in August. And like I said, hopefully at some point we'll be able to finish this discussion. We had a lot more questions to get through, and we would love to continue this discussion in the future. So thank you everyone for participating in the chat, sharing your stories. We really appreciate it. Thank you guys so much.